The brain is more incredible than people think, and what happens with conduction aphasia is a good example. It all began when a doctor fascinated by the brain had a patient who had suffered a stroke. The patient could understand spoken language pretty well, but he struggled to repeat sentences, phrases, and even words. This marked the beginning of the discovery of what is now known as conduction aphasia. There are many types of aphasia. Aphasia means that you have a language disorder that could make it hard for you to read, listen, write, and say what you mean to say due to a cerebral lesion. The most common cause is stroke, although it could also be due to traumatic brain injury, brain tumors, among other causes. There are many types of aphasia, which vary greatly in their symptoms, depending on the location of the injury. Conduction aphasia was traditionally thought to be caused by a lesion in the arcuate fasciculus, a white matter tract that connects Broca's and vernix areas, basically connecting the two main language centers of the brain, in the left hemisphere. For this reason is considered a disconnection syndrome, but this hypothesis has been challenged because the evidence shows that is not just the result of a damage to the arcuate fasciculus. Cortical lesions alone may produce conduction aphasia, specifically damage to the left superior temporal gyrus and/or the left supramarginal gyrus. Furthermore, lesions to the arcuate fasciculus do not always cause conduction aphasia. We must be very careful with the diagnosis of this aphasia. In most cases, it is considered a fluent aphasia. However, sometimes it may be thought to be non-fluent because the person makes many self-corrections, leading them to say fewer words per minute, which may cause the speech-language therapist to mistake it for Broca's aphasia. It can also sometimes be confused with anomic aphasia, whose hallmark feature is word-finding difficulty, but with very well-preserved comprehension. Both conditions share this latter trait. Nevertheless, this aphasia has unique characteristics that can help differentiate it from other types of aphasia. The main feature of conduction aphasia is impaired repetition. The longer and more complex the words, phrases, and sentences, the more difficulty they have with the task. It's also more challenging if they're asked to repeat non-words. Despite this significant difficulty with repetition, they can still read, write, and speak relatively fluently, and they are able to understand what others say. What makes it very different from other types of aphasia is that, whether in repetition or spontaneous speech, they often fail to say a word correctly by changing some of its sounds. This is called phonemic paraphasia. Although this phenomenon occurs in other types of aphasia, what makes it particularly interesting is that they simultaneously make repeated attempts at self-correction because they are aware of their errors, a behavior known as Conduit approach. For example, if asked to say refrigerator, the patient might say frigilator, no, frigilator, until they eventually say the word correctly. If you want to learn more about paraphasias, you can go here. In addition, some individuals may also have dysnomia, which means struggling with word-finding skills, a problem more commonly associated with anomic aphasia. However, this combination is rare. Finally, due to the proximity of the lesion to other parts of the brain with distinct functions, patients with this condition may exhibit ideomotor apraxia, a type of voluntary automatic dissociation where they are unable to perform mimicking gestures, such as pretending to use a tool like a comb or a pencil, despite having normal motor strength and intact movement abilities. They can also have oral apraxia, which is the inability to voluntarily perform movements involving the muscles of the face, lips, tongue, and jaw, even though the person has no weakness, paralysis, or sensory loss in these muscles. You can learn more about ideomotor and oral apraxia clicking here.